Chapter 2. So, in this chapter, we're going to cover pharmacy procedures and dosage calculations. We're going to start dosage calculations a little more separately from the book. I'll talk a little more about that. But the first thing that you need to know about is pharmacy procedures. And your book talks about how pharmacy is different than pharmacology. It's a part of pharmacology. It's the um, dispensing of drugs, basically putting them together, putting them in a container, getting them to the owner, and getting the instructions out there. So it's a particular part of pharmacology. It's a part that you're going to be doing a lot of in a practice, pretty typically. So you need to know about how prescriptions, what's required for prescriptions, and drug orders. Drug orders are the more common things that we deal with in veterinary medicine. And labeling of drugs. You will need to know how to calculate drug doses. I said we're going to be doing that a little separately. I'm going to assign things through D2L worksheets, and we'll go over those worksheets in class and kind of work through different sorts of problem types as we go along in the course. So while your book does have a section on that, and it's certainly a great section to refer to, we're going to right now sort of skip that section in particular in chapter 2. And I will give you instructions on that in D2L in the news item. So you'll also need to know how drugs have a particular way to be handled and stored. And certain drugs, in particular controlled substances, have very special requirements around that. Um, but any drug has some restrictions in how it can be stored, and so you need to be familiar with those. And then we'll talk about compounding and also cytotoxic drugs too in this chapter. So, who oversees um, clinic pharmacies? There's a different group of agencies that cover different parts of the things that we have, different types of drugs that we have in clinics. The Drug Enforcement and Administration, the DEA, is over controlled substances. Um, and Food and Drug Administration, of course, controls the approval um, and labeling of drugs, and then and that includes medicated feeds. I want to kind of put that in there. This is sort of a new thing. In the last year, there was a new regulation that food producers need to have veterinarian approval, and they have to have a relationship with a veterinarian that knows their operation in order to get food that has medication in it. In the past, that was not true. So this is a relatively new thing. It started in December of 2016. And then USDA, the Department of Agriculture, is over what we call biologics, things like vaccines, bacterins, um, things that are, and some of the diagnostic test kits that involve biologics. So it's kind of a separate little area over the vaccination part, those types of drugs that are in your clinics. The EPA is over things that can have contact with the environment. So these are things like pour on um, insecticides for large animals, sprays that treat topical sorts of things that may get into the environment. So they have a place in the regulatory area as well. So we need to know the protocols for writing prescriptions, for calculating drug doses, and handling, storing, and compounding drugs, because these agencies in particular have certain things that if they come and inspect your facility, they will be looking for certain things. So it's important to know about what we need to do and how to handle drugs in your clinic. So, there is a difference between a prescription, which if you have gone to the doctor and received a prescription and you take it to your pharmacy, or it gets called into your pharmacy from the doctor's office, um, it's different from what we call the drug order. And the drug order is something that's very commonly used in veterinary medicine because we are technically the doctor's office and the pharmacy all in one for many drugs for our patients. So the drug order it's a request. It's used within the clinic or hospital, so it doesn't go out of the hospital. You can't request another hospital to fill your drug order. And it's going to be written in the animal's medical records. Actually, I would say that's going to happen with a prescription too. You want to definitely have that in there. The prescription is a formal legal document. It's a document that the veterinarian writes to be filled by a pharmacy professional outside of the clinic. So typically a human pharmacy, or many human pharmacies have now become compounding pharmacies for animals, adding flavorings and making drugs the proper concentration for treating, say, small animals. So this would be something that is sent out to that pharmacy and filled there. And only the pharmacist can fill it. So as I was saying, you can't write a drug order for another clinic. That technically to fill, that technically is a prescription, and that is illegal. That it makes that other um, clinic be a pharmacy, which it is not. That's a whole other legal entity. So the drug order stays in the clinic. So a drug order is a request by the veterinarian for someone to fill or administer the drug to the owner of the patient, uh, and it is all done within the hospital. So this can be accomplished in a couple different ways. The veterinarian can write the order in the patient's medical record, and or they might have a special form in the clinic that they do this with, or they might write it on a dry erase board in the clinic in the pharmacy area. Sometimes there's recurring prescriptions that animals need over time, whether it's for a pain medication like Rimadyl for treating arthritis or thyroid medication, and it's a recurring amount that can be filled a certain number of times. And so sometimes it's just a request to, fill a prescription for the owner coming in and picking up a refill for a drug. It can also just be transmitted verbally, but ideally it needs to be recorded in the records. It absolutely has to be recorded in the medical record, in some way, shape, or form. So that's probably the best way to transmit the request for the medication, the drug order. And a drug order can be written as this one is at the bottom of our slide. So there is this RX symbol that is basically a symbol saying it's a prescription drug, and it technically means in Latin "take thou of." It's basically talking about taking the drug, but it's written as 250 milligram tablets of amoxicillin. This is in our abbreviations that we're going to need to be familiar with. So this symbol is a hashtag. You all are familiar with that. But in the pharmacy world, that is a meaning of a number of tablets. And that's the way to transmit that you are dispensing 14 tablets. And then this symbol, sig, or little word sig, it's a Latin word that is giving instructions basically. So the instructions are 1 tablet BID, or twice a day per us, orally for 1 week. And so that is a drug order as it may be written in a record. So the prescription is something that gets sent out of the pharmacy, filled by a pharmacist. It is a legal document. Sometimes clinics will go ahead and to make a copy of it. It's important to note that legal prescription pads should be stored in some very specific place. They should be secured because they offer the potential for abuse, for someone to grab that prescription pad and forge a prescription. So it's a very important legal document. Sometimes these are sent electronically. We just have more capabilities these days to transmit things in a different form, and that offers some security too when it's being transmitted from a veterinarian's office to a pharmacy. So, guidelines for writing the prescriptions or the drug orders. There needs to be a relationship between the veterinarian, the client, and the patient. And what can happen is an animal is seen, you do a fecal sample, you look at the fecal sample, there are some parasites, the veterinarian prescribes a parasiticide for that particular animal, and you are dispensing it to the client, and they look at you and say, oh, could my other dogs have this too? And um, it's something that you can anticipate when you know the client and you know how many animals they may have, or you go and look at their record. So the thing is that you can't technically prescribe, the veterinarian can't technically prescribe to the other patients unless they have been seen in the clinic. So it's important to note, when that animal was seen last, and let the owner know that no, we're going to have to see those animals, those other animals, if we're going to give them something to. So the drugs have to meet proper requirements for labeling. We'll go over that. And then, of course, we have to maintain the appropriate records and handle the drugs appropriately from when they come into the clinic to when they're dispensed to the client. And we sometimes need to tell the owners what needs to happen with that drug in order to properly um, keep it and keep it viable. So the components in a prescription, this would be typically on a pad of paper, or we now have electronic forms of these, but it has to have a name and address and phone number of the clinic. It has to have the date of the prescription, the information about the patient, including what species they are, and the owner's information as well. And then we have this RX part, which is basically telling us what is in that prescription. So these are amoxicillin tablets. That's the name of the drug. This is the dosage form, tablets. This is the amount of drug in each tablet, 100 milligrams. And again, this is our hashtag, meaning this is the number of tablets, so 30 tablets. And then this is the instructions for giving the drug. Give 1 tablet by mouth every 8 hours until gone. The number of refills. Certain drugs that are controlled substances cannot be refilled. They have to have a new prescription written every time there is a refill. And then the signature, and it can be electronic, of the veterinarian.